Hi everyone, I'm Dr. Karam. I'm a board certified facial plastic surgeon. I specialize in facial rejuvenation, and today we're going to talk about the aging of the eyes. A lot of people come in, they complain about how their eyes look tired, how they don't look as bright as they used to, and after this video you're going to understand why that is. You're going to understand exactly how the eye ages and what type of treatments work best for rejuvenating the eyes. And what's really important after all of this is you're going to learn how to keep yourself out of trouble so that you don't make common mistakes that lead to unwanted outcomes that so many people get when they are treating their eyes. So let's kind of break it down step by step here, and we're going to start with the most important understanding, which is how the aging process affects the eyes. So when we talk about the periocular area, what we're talking about is this entire region surrounding the eyes. So periorbital or periocular basically means from nose up. Now, there are several changes that are happening to this area, and they oftentimes begin in the late 30s and early 40s. So that's usually the time when people start to notice, whoa, I don't have that same brightness, or sometimes there's genetic factors involved where somebody is in their 20s or even teens, and their whole life they've been told, hey, did you sleep last night? What's going on? You look tired. What are the components, the factors that are affecting this? So number one factor affecting the periorbital area is aging related volume loss. So what is the volume consist of? It's the fat around the eyes. Now, there are deep fat pads surrounding the eye in the temple and the upper cheek that frame the eye. When we're young, those fat pads are going to be full and they're going to have smoothness, light reflex as the light hits a convex or a neutral surface. But as we age, we start to see those surfaces becoming more concave. And when things become concave, they cast a shadow. So what you start to see is overall things look more gaunt, overall things look more tired, and areas, for example, under the eyes, they look darker. So let's understand this a little bit more carefully in each component. So the under eye area, there's a fat pad that lives right above the orbital bone. Now, if you touch your eye here, your eye socket, you'll feel the bone right underneath your eyelid. That bone is normally covered with a layer of fat called the SUF fat. That is the suborbicularis oculi fat pad. Now, that fat pad is a very thin layer, but what it does is it creates a nice transition between your eyelid and your cheek. That border, as it loses volume, you start to see the line of demarcation as basically a crescent shape in between the eyelid and the cheek, and that is what makes the eyes look tired, that hollowness that happens there. Now, when it happens specifically in this portion of the eye, we think of it as a tear trough deformity. Now, I'm going to explain why all of this is so important in a moment. Above the eye, you have the orbital socket above it. It also loses volume as we age. So the upper eyelid area begins to diminish its fullness, and as a result, the eyes become deflated looking. Now, above and below undergo the same sort of volume loss, but guess what? So does the temples, and so does oftentimes the upper cheek area. So what ends up happening is you see in the temporal region, there becomes a concavity in that area of the temple. That concavity also makes the eyes look indirectly tired. Now, you can't always put your finger on what it is that makes somebody look tired, but I'm giving you the tools to understand in yourself and others what it is that is contributing to that. So the volume loss in the temporal region is related to the deep temporal fat pad. There's a fat pad that sits along the bone, and that begins to diminish as time goes on, and as a result, the temporal fossa, which is this region right here, begins to cave in, and you get that shallow or hollow look to it. So why is this all so important? Well, one of the features that makes an eyelid look youthful is the distance between the eyelid and the cheek. We could refer to this as the eyelid-cheek junction. And what happens is, with age, as you lose the volume in this area, the distance between the eyelid, which is basically measured at the level of the lashes, and the beginning of your cheek begins to get longer as this fat pad, the SUF fat pad, goes away. You can see this very clearly on profile views, and as you can see here, we can look at the difference between the preoperative longer eyelid cheek junction and the post-treatment shortened eyelid cheek junction. And that is a really important part of a youthful looking eye, the eyelid cheek junction. So now, the question then becomes, how do we treat this aspect? Now, I'm going to get to treatment in a moment, but first I want to break down the other components of the aging process around the eyes. So the other two components are the upper eyelid skin and the lower eyelid skin or fat. Now, notice I said skin or fat because in some cases, people age by developing extra skin on their eyelids. That's much more common. And in other situations where somebody has a hereditary predisposition to eyelid bags, you're gonna see a puffiness under the eyelids form. Now, some people refer to that puffiness or think of that puffiness as excess fat, but in fact, every one of us have the exact same amount of fat underneath our eyelids. Our eyeballs are sitting inside the bony eye socket and it's surrounded with fat. And the division between the inside of the orbital components and the outer portion is the eyelid. The eyelid has a barrier called the septum. In some people, that septum becomes weak and it starts to bulge under the pressure of that eyeball pressing against the fat and then causing the eyeball to kind of create this bag underneath the eyes. And you can really see that either on a front view or on a profile view. But that is not a problem of excess, it's just a problem of support. So in some situations, you need to remove some of that pressure along that region, and then the act of surgery working on that region, the septum, actually the scar tissue and the fibrosis that forms actually strengthens the septum, and therefore you rarely see this happening again and again as time goes on. So breaking it down, the aging process of the periorbital region. Number one, volume loss. This is ubiquitous, but it's truly very, very uncommon to see aged looking eyes without a component of volume loss associated with it. The second is the excess skin of the upper eyelid. The third component is either excess skin in conjunction with excess fat or this bulging fat pad, or just one or the other. So there is the diagnostic properties of the eye. Now, let's talk about treatment. If you are younger and you don't have any excess skin or puffiness, but you do have a little bit of a small tear trough deformity, well, your problem is primarily volume loss. If it's a small amount of volume loss in that region, you are a perfect candidate for something very simple like a filler. Now, I'm going to go through the pros and cons in a moment. In small quantities, and I mean like, a quarter or to a third of a cc of filler placed in the tear trough can be very effective. Now, one caveat is make sure that the filler is not very hydrophilic. So personally, I've always used Restylane. I know there's a few other ones on the market, but for example, Juvederm historically has been very, very problematic under the eyes because it loves water so much that it gets really puffy. But any filler can have that when you're using it in excess quantities. And I'm going to talk about that in a second here to understand this a little bit. When it's early and you just have a tear trough, filler is a great option. When the volume loss extends all throughout the orbital rim and the upper cheek region, well, guess what? You're going to require a lot of filler in that region. What is the problem with using fillers in that region? Well, just as I mentioned, fillers are inherently foreign bodies and they are inherently molecules that absorb water. That absorption of water causes the filler to expand like a sponge. So in a lot of patients that use fillers in excess, like half a cc to a full cc under their eyes, they always come back with some puffiness and some discoloration. The discoloration is related to a phenomenon called the Tyndall effect. The Tyndall effect is just the fact that there's too much of this sort of translucent material in a superficial plane underneath the eyelid, and the eyelid is not very thick, so it transmits the light in a way that causes it to look either bluish or brownish, and that's what the Tyndall effect is. If you see that in yourself, you know you've probably had a little bit too much filler placed in there. This also happens to people who are using fillers in larger quantities over and over again. Invariably, it ends this way. So what do you do in cases where you have relatively significant amount of volume loss, or the volume loss extends around the eye in the temporal regions as I just discussed? Well, in those cases, in my practice, the best way of addressing this in the safest and most natural looking way is to replace what has been lost the fat has been lost, and I'm going to replace it with a fat transfer. Fat grafting or fat transfer in my practice is something that I do literally every day. I know it's not an option that's available everywhere, but in cases where you have access to an experienced surgeon who knows what they're doing with fat transfer, it is a phenomenal and beautiful outcome, as you can see by these before and afters. The results are very, very natural looking. They end up looking stable because it is a graft. It doesn't dissipate with time. It's not a foreign body, so your body's not trying to break it down. Instead, it welcomes it and then makes it a part of its normal tissue. And as a result, you do fat transfer once. If it's done properly, you're done. Never have to do it again. And it gives you the flexibility of treating above the eyes and the temples and the cheeks and the lower face if needed to get the entire volume status back up where it needs to be. So fat transfer is my weapon of choice for volume loss. Now, when it comes to cases where you have excess skin or puffiness under the eyes, this is where decision-making becomes very important, because the problem is not just volume loss. Remember, we had 3 different criteria for diagnosis. We have volume loss and excess upper lid and excess lower lid skin. So when you are treating this region, you got to remember, people are looking at you in this whole area. They're not looking at your lower lids or your upper lids or one area or the other. They're looking at this whole area when they're looking at you. So when you do a procedure, you want it to be comprehensive, because comprehensive is an important quality of looking natural. So the last thing you want is to have aged-looking upper eyelids next to a really youthful-looking lower lid, or vice versa. So whenever I personally treat the eye region or the periocular or periorbital region, I treat the whole thing. I assess and then put together a treatment plan that encompasses the entire area. So if they have excess skin on the upper lids, we'll take away a little bit of extra skin on there with a blepharoplasty. If you have extra skin on the lower lid, I use a technique called a lower eyelid skin pinch, where I just make a small incision underneath the eyelashes, and I pinch the excess skin and I remove the unwanted or unneeded extra skin. And being very careful, again, this is a delicate procedure. If you take too much skin, you could cause problems with the position and shape of the eye. On the other hand, if you do it properly, it's just the excess skin and the eye shape never changes. And then if you've got puffiness under the eyes, I'm going to do a technique called a transconjunctival lower blepharoplasty. It's a fancy term for, basically, I go from the inside of the eye, take out the puffiness that is causing that bulging and pressing against the septum, and as a result get a nice flat contour in that region. And then when you combine all of these things together as needed, what you end up with is a very refreshed looking eye. You end up with an eye that looks natural. Nothing has changed with the shape of the eye, because I know that's a common concern for a lot of people. And as a result, you end up getting that bright, youthful looking eye that doesn't look tired, and you don't walk away looking like a different person or having some of those unwanted or things that are very scary when we see out there, where all of a sudden, you know, the eyes look really angular or the skin is really tight, and you hear about people not being able to close their eyes, etc. These are all problems with poor technique and inexperience that can lead to that type of thing. So don't be afraid of these procedures, but make sure you do your homework and pick a surgeon who is very experienced in eye rejuvenation, and you see plenty of evidence of good outcomes and natural looking outcomes. So those are sort of the overall, you know, concepts surrounding this. Most cases involve one or all 3 of these areas, especially if somebody is in their 40s and 50s and above. It's rare to have one aspect involved in the other. You certainly can have that in somebody who's in their 30s or their 20s who have genetics where they have just maybe hollowing, and you just treat it with either a fat transfer or some filler. So let's break it down in terms of how to stay out of trouble. So I would say probably 2 to 3 times a week, we get patients that come in who have this problem with these overfilled tear troughs and lower eyelids because of filler. How do you keep yourself out of that? Here's some self-diagnostic. If you have a fat pad that is bulging forward, invariably your injector is going to try to fill your lower eyelid to the point where it creates a smooth contour between the top of the bag and your cheek, because again, that's the whole idea, right? You're trying to create a smooth transition, but that's too much filler under the eyelid. Remember, my first criteria was you have to have very small amount of volume loss in order to be a good candidate for filler use. If you see yourself as having puffiness under your eyes, trust me, you're better off waiting, researching, doing what you got to do to get a properly done blepharoplasty plus volume augmentation with fat transfer for that region, as opposed to jumping in and just packing it in with filler. Now, let me also say this. Personally, I never, ever, ever treat the lower eyelid. I mean, I'm gonna say this, very generalized because it's almost always true, without adding volume to the lower eyelid region, because that seems to be the constant component in there. So if you end up getting a lower blepharoplasty without fat transfer or some type of volume augmentation, invariably you're probably gonna notice that your eyes are gonna still look hollow and still look gaunt and you're still gonna look tired, but yeah, you won't have the excess fat pad sticking out. And that's kind of an old school approach to eye rejuvenation. That's actually been the thing that has prompted me to fall in love with fat transfer, recognition that the volume aspect is such an important part of it. So for my patients in my practice, I never do a lower eyelid surgical procedure without the addition of volume. So that keep that aspect in mind, because if you do, so what are some of the problems? You get the Tyndall effect, the excess volume, and a lot of people will see a need to continuously chase this. So this is what happens when you have puffiness or even excess skin on your lower lids and you get some filler under there, you don't get the satisfactory outcome that you're looking for. So you go back 6 months later and then again 6 months later, adding more and more and more volume to try to fix that problem, but realizing that again, your problem might be because you have excess skin or fat in addition to volume loss. So you can't fix all of the problems with one procedure. And that is a kind of a downward spiral that we see with a lot of patients who end up getting treatment after treatment with fillers. And then even though maybe the first couple treatments turn out okay, the third and the fourth one starts leaving the eye looking the puffy and hollow, discolored look that is so notorious with filler use. So one other piece I want to add to this is I've been hearing a lot of things about people wanting to get lasers and different type of deep treatments underneath their eyelids to tighten up the skin and fat or help improve this area non-surgically. Here's the problem with that. The eyelid skin is extremely delicate. It's very, very thin skin. When you put a lot of heat on it, whether it's through a laser or whether you put it through some type of ultrasound treatment or radio frequency treatment, what ends up happening is maybe it doesn't show this right away, but in the long run, it starts causing thinning of the tissues, and as a result causes more problems with the quality of the skin than it would if you just simply went in and just in a very controlled way, took out the extra skin directly or took out the fat pad directly, and leaving the skin completely untreated. The extra skin comes out, but the quality of the skin can be continuously improved. That crepey quality can be improved by the use of proper products. For example, the Trifecta, which I developed, can be used very effectively on the lower eyelid, and a little bit of retinol, vitamin C, in addition to the growth factors and all the other pieces that are involved in the Trifecta, can build and tighten and firm the quality of the skin over the long run. So in other words, you treat skin for skin, you treat the excess surgically, you add volume, in the ways of fat transfer or in small amounts with fillers. Those are sort of the guidelines, the understanding of the diagnostic aspects, the treatment options that are available to you, as well as kind of how to piece these together, but also how to stay out of trouble. So I hope this helped give you a better insight into a very common part of the aging process, which is the aging of the eye region. Notice I say eye region again because I'm thinking comprehensively. I want you to think the same way. If you have any questions at all about this, jot them down in the comments. I'll be more than happy to discuss or answer them. You can also find a lot of information on my website, drkaram.com, as well as my Instagram site, which I post a lot of content on there as well. That's just Dr. Amir Karam is the handle there. And if you liked it, make sure you hit like, share it with friends and family, because this information, we need to get it out there to help people stay out of trouble. And if you haven't already, make sure you subscribe to this channel. Every week or so, you're going to get more and more content on a variety of topics, and stay tuned for more information about fat transfer and some of the other things that affect the aging face on the subsequent videos. I hope this helped, and it's my pleasure to bring this informational and educational content to you. Thanks again, Dr. Amir Karam.